I'm Jonathan Larsen, and this is The Conversation. And as I mentioned earlier, there is a criminally underreported story going on, a horror story that's been unfolding since the beginning of the pandemic. And there is a really important new piece on it. And I wanted to bring in the author of that piece, the reporter and writer behind it, Amy Littlefield, freelance journalist who wrote the article that I'm talking about for a recent issue of The Nation magazine. Amy, thanks so much for being here.
Thanks for having me, Jonathan. It's great to be with you.
So what I found fascinating about the piece, this was actually something I had thought about and kind of kept a side eye out, waiting to see coverage about this, was essentially access to abortion for women during the pandemic. We've heard a lot about other health issues obviously related to the pandemic. It hasn't felt to me like we've seen a real strong focus on this until your piece. It's certainly possible that I've missed some. And one of the things I found fascinating about it was the layers of intersectionality here are just kind of staggering. Obviously gender, the obvious one, but also it disproportionately, as with so many other health issues in the pandemic, it disproportionately hits women of color, young women, obviously, poor women, people with, your article starts off with a woman wearing I forget what you said, the term used for it. Thank you. In the article, so there's so many layers to this, and I want to drill into some of those, but I want to start off with your assessment of what has happened, the beginning and throughout, to abortion access around the country through this pandemic.
Yeah. Thanks so much for framing it that way. I think we have to first take a step back and realize that abortion access was in crisis in this country before COVID hit. And that crisis hit people differently depending on where they lived and depending on their economic circumstances and the inequalities they were already facing in their lives. So many states have all but regulated abortion out of existence. And in some cases, such as South Dakota, we saw that COVID was sort of the final straw that knocked out abortion access in that state for 7 months because the last clinic in South Dakota just couldn't operate anymore. It was that COVID was the last hit that sort of knocked the lights out in that clinic. In other cases, we saw states really seize opportunistically on the pandemic as a chance to do what they've wanted to do for some time, which is ban abortion. And they did so under the guise of preserving PPE and calling it a non-essential service, which, for people who were pregnant, especially at that time, felt like there was nothing more essential in the world, right, than being able to have bodily autonomy. And, in many ways, we saw this sort of dress rehearsal or dry run for what it could look like when the Supreme Court overturns Roe v. Wade, and we have whole regions of this country that might ban abortion outright or at least heavily restrict it. I think there's another side to that, which is we saw these sort of openings in abortion access during the course of the pandemic. We saw a lot of people turning to methods of self-managing abortion and supporting each other through self-managing abortion outside of the sort of traditional clinic model. And we saw abortion funds, which are these grassroots organizations that exist to help people access abortions that they couldn't otherwise afford. We saw them really accomplish these amazing feats of heroism, really, I would argue, in order to get people to the care that they needed. I mean, down to, one abortion fund that serves Native patients actually managed to find someone to take a private airplane and fly to pick up a patient in Montana and fly her to Colorado because it was her last chance to secure an abortion after she'd spent months trying to raise the money to afford it.
And there was one case I was very interested in the sort of heroes that you refer to. There was one case, I may be conflating some of the details. This might have been the bartender who drove, I think, with members of his family, perhaps in the car with the person that they're transporting, and he contemplates, I guess, talking with you, he contemplates a future in which even the facilitation of an abortion could become a felony in his state. And he says, I anticipate that I'll continue doing it if that's the case.
Right. Yeah, I mean, I love that character, Will Anderson, because there are many people who you might least expect in this country who are standing up for abortion access. And Will and Caitlin Anderson, needed access to an abortion themselves. And they have 3 kids. They couldn't afford another one. And Caitlin went to the abortion clinic in South Dakota. And when access was shut down at that abortion clinic during the pandemic, they, picked up a stranger in their car, put their 2 sons in the back seat, and vowed to do what it took. And so, and yes, they are among the many people in this country who are saying, regardless of what the law is, we will stand up for abortion access. And I think it's really beautiful to look to these examples. It's also important to acknowledge that, given the sort of feats of heroism that were required, many people, and we don't know exactly how many, were not able to get to the care that they needed and were forced to stay pregnant when they didn't want to be.
And they ended up having babies. Presumably.
We can assume that. Yeah, exactly. I
did have some statistic in there. I think there were some estimates, like individual states estimated maybe hundreds of people in some states, but I think it's a fair assumption that hundreds and possibly thousands of women across the country may have had children that they did not want to have, that they were perhaps had really important, valid reasons not to want to have, because of not just the pandemic, but because of the draconian measures that were implemented during the pandemic. Does that sound roughly right?
Right. I mean, and of course, this was the case even before COVID, and this just became one more layer on top of it. For example, you mentioned the case of Loretta Lee, who's the patient I mentioned in the story who sought an abortion in Ohio. She had to go into a clinic on a Friday, spend a few hours there, have an ultrasound, undergo a counseling process, sign a bunch of paperwork, and then leave and come back on a Monday to get the first step in her medication abortion regimen that she wanted. That's because Ohio has a 24-hour waiting period. It's also a state where you can't get your Medicaid plan to pay for abortion. And so, Loretta was able to access money from an abortion fund to pay for that. But there's all of these different barriers that then became, potentially frightening risk. You could contract COVID when you're having to make those extra visits, and you're putting medical staff at risk. So yeah, we don't know exactly. We know that close to 1,000 patients in the state of Texas sought care outside of that state during the month of April alone, when there was this sort of revolving door of clinic closures because of the legal battle over the state's attempt to ban abortion there. But we can't say exactly how many people, were not able to get the care they needed.
Is your sense, as we start to get a glimpse of life after the pandemic, is your sense that these measures in, I guess it's maybe a dozen, 18 states or so, do those measures feel like they've successfully used the pandemic to further encroach on abortion and reproductive rights in those states? Or is this more of a temporary wave that gets rolled back?
I think this was more of a temporary wave. I think, it remains to be seen. I think a lot of what you're seeing at the state level is law after law after law that's aimed at sort of giving the Supreme Court its range of options in terms of which case it might use to, overhaul the existing precedent on abortion access. But I think
I just want to jump in there. I believe I'm right about this. Correct me if I'm wrong. There's a concerted effort among the various states to throw a whole range of cases up there of laws specifically to give the Supreme Court what amounts to a menu of options to act on Roe v. Wade. Do I have that right?
Of course, and they'll have no shortage of cases out there. There are many cases in the pipeline already, and even more making their way up there. And the Trump administration succeeded in packing those courts, lower courts, on their way up to the Supreme Court as well. But I think there's a really important chilling effect too, and it can't be overstated. a lot of people assume that abortion is illegal or inaccessible because of these attempted bans and the way that they're discussed. And so it is important to state, for now, abortion is legal everywhere, and there are a range of ways to access it, both in the sort of traditional way and in sort of different non-traditional ways online.
Well, that's a really good setup for just quickly before we go. Anyone who reads the article at The Nation, which I highly recommend, or has watched this and wants to help, what can they do?
I think one thing is pay attention to what's happening at your state legislature, because almost all of the really harmful anti-choice policies we've seen that are important have been at the state level. And find out what your local abortion fund is doing and how to get involved with them, because these are the groups that are sort of the heart of the grassroots movement in terms of preserving abortion access.
Great. Amy Littlefield, freelance journalist. The article is in The Nation. It's up on the website. I highly recommend people go check it out. Amy, thanks so much for being here.
Thank you.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.